Hello friends, today we will learn about hepatitis C virus. This virus is important as it directly affects the liver, and how it is becoming more important as this virus can bring the disease to the chronicity, and this chronicity can lead to the carcinomas or the cirrhosis. So now start that what is this virus. So we will learn in detail about this virus. Now this hepatitis C virus, it is a common cause of post-transfusion hepatitis. So as we know, like hepatitis A, hepatitis E, they were transmitted by fecal route. But this B and C, they are mainly the parenteral route was there. Now this hepatitis C is very important as we talk about the also known as the post-transfusion hepatitis in the developing countries, and it was labeled as non-A non-B. So it was labeled like E is also labeled as non-A non-B, but it is enterically transmitted non-A non-B. So if you get some question related to any MCQ related to this, so when if they are asking enterically transmitted non-A non-B, then it is hepatitis E. Hepatitis C is non-A non-B hepatitis virus. Now this virus belongs to the family Flavividae, and the genus is the Hepacivirus. This is the RNA virus. As we know, all the hepatitis viruses are RNA virus, only the hepatitis B virus is the only DNA virus. It is spherical in size, 60 nanometer size, and it is envelope virus. So when we talk about the morphology of the virus, so there are structural proteins as well as non-structural proteins. Now structural proteins means these are the proteins which help in making the structure of the virus, and non-structural proteins basically they are used by the virus for functions. So in the structural protein there are three structural proteins are available with this virus. One is the C, that is the core protein, and two are the envelope proteins. These are the E1 and E2. So C, E1, E2. Now the non-structural proteins are there. 6 proteins are there. So these are the NS2, NS3, 4A, 4B, NS5A, and NS5B. So these are the non-structural protein. Now why this hepatitis C virus is important? That this virus has a very diversity in the RNA genome because of the high rate of the mutation in the virus. This virus has the high replicability also. So that is why the RNA genome it shows a lot of diversity. Now this virus is divided into 6 major genotypes. So what do you mean by genotype? Basically that is the variant of these viruses when they differ in the genetic sequence. So they are known as the genotypes. So when we talk about there are 6 different genetic sequences can be present in a HCV virus. And why these genotypes are important? Because the treatment of any person who is suffering from the HCV infection is based on the genotype only. So the latest treatment is being based on the genotype because certain genotype responding to certain drugs are resistant in certain genotypes. So therefore the genotype is very important if a person is suffering from hepatitis C virus. Now, when a person suffers from hepatitis C virus, so mainly the antibodies which are protective in nature, they are formed against the E2 protein. So I have already told you there are 3 structural protein C, that is the core, even E2. So the antibodies, neutralizing antibodies are being formed against the E2 protein. So that is an important MCQ. Now the genotype 1 and 2 is common in the Western countries, and when we talk about India, so 1 and 3 are the more prevalent genotypes. So this is the hepatitis C virus structure where you can see these core protein E1, E2, and you can see the RNA nucleocapsid. Now how this virus can transmit? So main route is the parenteral. It could be either blood transfusion, it could be needle prick injury. So any parenteral route can be there. Vertical transmission, that is from mother to child. So vertical transmission is more common in hepatitis B virus, where is 20% chance of transmission of the infection, whereas in case of C virus, it is very much less than the B virus, so it is 6%. Then the sexual transmission is there, and it is also not spread through the breast milk, food or any casual contact. So mainly the transmission is parenteral, and as you know, the post-transfusion hepatitis also it is being labeled as hepatitis C virus. Clinically, when we see how a patient of hepatitis C virus being present in the OPD or the IPD, so the person is having the when this virus is getting the inside the body of the human being. So when the symptom will come, that is approximate 15 to 160 days later. So this is the time when the virus will replicate and then bring about the symptoms. Following an infection, what can be the presentation? That is, more than 75% of the cases in the initial stage, they are asymptomatic. That is, no symptoms are there. But 20% can have acute hepatitis. So as we have learned in other hepatitis viruses, that a person presents with, first there are pre-ictic symptoms are there, then there are ictic symptoms. So all the hepatitis have almost similar symptoms. In pre-ictic stage, they have nausea, vomiting. So later on, when the ictic phase comes, so they will be, ictic means jaundice. So they will be, you can see the yellowing of the sclera, so or yellowing of the fluids. So that is the ictic condition. So in acute hepatitis, then spontaneous clear. So in 5 to 15%, the virus gets spontaneously cleared within the 12 weeks. So without taking the treatment also, the patient can be free of this infection, but it is only in 5 to 15%. Approximate 75 to 85%, all those persons who have acquired the infection, they develop the chronic disease. And now this chronic disease, among all the hepatitis virus, the chronic disease is maximum chances is in hepatitis C virus. Like A and E, they don't have this chronic disease. B, C and D, they all three show the chronic disease. Now this chronic disease is a very complicating situation. So when a person develops, this infection persists in his body and he is having developed into chronic disease, so there is chance of like 60 to 70% of the person who have developed chronic disease, they can go into chronic hepatitis. That is, there is a chronic inflammation of the liver. But 5 to 20%, which is a big percent, they can develop the cirrhosis, and 1 to 5% can land up into the hepatocellular carcinoma. So these are the problems. When you say which infection is more worse, so although the transmission rate, infectiousness of hepatitis B is more than hepatitis C, but when we see how the patient progress, so it is more worser condition in hepatitis C because the patient chronicity of disease is high and can develop chronic hepatitis, cirrhosis or the carcinoma. So all are the difficult or the complications. Now there are some extrahepatic manifestation can also be there, that is the mixed cryoglobulinemia, glomerulonephritis, arthritis, joint pain. So mainly the immune complexes can form and they can harm the different organs, so they can get deposit there and there can be some immunological complications. So when we talk about of epidemiology of this virus, so we all know that worldwide this virus infection is very common, and every year 3 to 4 million people are infected, more than 3.5 lakhs deaths are there, and higher prevalence rate has been seen. So maximum जो prevalence है, that is seen in the Africa, it is up to 10%, and India the prevalence is 1%. Now, how we can diagnose those hepatitis C virus infection? So, ELISA. So, as we know, whenever you are writing or you are thinking about the diagnosis of any viral infection, so it is very difficult to culture any virus. So, viral cell lines, cell culture, they are mainly for the research purposes. So basically when we are diagnosing any viral sample, our most important focus is on either the antigen or the antibody. So for the diagnosis, we always prefer all the practical, that is which is a cheaper test, which is economical, which is easy to do. So always these are preferred. So ELISA, antigen antibody test, they are available. First, second generation, they are have been obsolete now, they are not being used. Third generation ELISA are being used, where this NS5 antigen, that is the non-structural protein. So this in addition to the core C, NS3, NS4. So these are the target which they use, and antibody is being detected against these antigens. In the past, the REBA, whenever there was some confusion, the REBA were being used to confirm the ELISA test. But this REBA is based on the Western blot technique only. But nowadays, this is the recombinant immunoblot antibody assay. But nowadays, it is also being not used. So what we are using? We are using the ELISA for detecting the antibody targeting certain antigen of the viruses. And this is the third generation ELISA. Now, some automated quantitative HCV antigen tests which are detecting the core antigen. Like in the previous, I have told you ELISA targeting the core and certain non-structural proteins. But now the newer test has come where quantitative, you can also quantitatively know that what is the viral load and you are detecting the antigen. So automated machines are being coming, and this test is less expensive, less time consuming as compared to PCR. As we know, PCR is a costly method, and although it is a gold standard method, but it is not possible for every patient to bear that burden. So that is why other options are being find out. So we can go for the automated quantitative HCV antigen test. Then a newer ELISA format has also come that can simultaneously detect the antigen as well as antibody. So antigen against the core antigen and antibody to the NS3 and S4 antigen. Now the real time, that is the RT-PCR, because it is a RNA virus, so you have a reverse transcriptive PCR, and real time method you can, it is the gold standard method for diagnosing or confirming any HCV case. So where you can use whenever you have any doubts, you can confirm the active HCV infection. If when we are monitoring any positive case, so we have to know the viral load also. So that quantification is possible with the real time reverse transcriptive PCR to monitor the treatment. And the third benefit is that you will simultaneously know what is the genotype and subtype of the virus, so that you can choose the treatment according to the genotype. So that is a very important test for diagnosing, for treating, for monitoring the patient. Now, what the CDC recommend? The CDC recommend two-step testing. That is, they are saying first you go for the antibody test, that is anti-HCV antibody test. There are rapid cards, there are ELISA tests are there, so you can do that. And if the person comes positive, then you can confirm with the HCV RNA. If it is coming negative, then you don't have to go for any molecular testing, except if the person is immunocompromised. So if the person is immunocompromised, there is a chance that the person's immune system is not working properly. So the person will not have the antibodies against the HCV virus. So if you go for the HCV antibody test, so it will come negative. So there you have to go for the molecular test. Now, one-time hepatitis C screening is also recommended by CDC, that anyone who is aged more than 80 years and all the pregnant female during each pregnancy, they should go for the HCV testing. That is the molecular testing, and where the HCV prevalence is more than 0.1%. So those countries which have the prevalence rate more than 0.1%. So in our country, India, we have a prevalence of 1%. So there, all the person who are more than 18 years, all the pregnant women in each pregnancy should go for the HCV testing. For the high risk group, regardless of the prevalence. So all the countries, regardless of the prevalence, whether they have a less prevalence, all the high risk groups should go for the one-time hepatitis C screening. That is, people with HIV, drug abusers, so they should or they are having the repeated blood transfusions, so they all should have the one-time screening for the hepatitis C. Now, how you can treat the patient of HCV infection? So, what is the goal? So, goal is that to prevent the development of complication. So, the person should not have the complication of cirrhosis or the liver cancer. Second thing, you cannot completely remove the virus from the body, but you can have a sustainable viral response. And that is, the level of the virus in the body should be below 15 international unit per ml, so that it will not affect the person's body. So that is known as a sustainable viral response. There should be less than 15 international unit per ml. Now, initially in the past, interferon alpha plus ribavirin, they were used for treating the hepatitis C virus infection. That is the pegylated interferon. But there were lots of complications and adverse effect of these drugs, and the viral clearance are also not so good. So the person is having lots of complication, lots of side effects, but the virus is not being cleared. So therefore new treatments find out, and these are the directly acting antivirals. So they are now the treatment of choice for HCV infection to produce the sustainable biological response up to 90% with minimal side effects, so that it should not affect the life of the person also, and the viral load should also be very less. So combination therapy is being preferred so that the drug resistance should not be there. So combination of this without or with pegylated interferon ribavirin, and it is mainly dependent on the genotype specific. Most of the directly these acting antivirals, they are genotype specific, except the sofosbuvir and velpatasvir. So they are active against all the genotype, but rest are specific to specific genotype. Duration what we choose, that is 12 to 24 weeks, depending upon which genotype is affecting, and it also depends upon how the person body is responding, because every person has different level of immunity, different level of their response to the infection. So that also matters, how this virus is replicating or whether there are any complications are present or not. So depending upon that, the duration can be extended or it can be within the same range. So what are these directly acting antiviral agents? That is the NS3. So these are all the non-essential proteins against which these drugs are acting. NS3 4A protease inhibitor. So they are the grazoprevir, paritaprevir, NS5B inhibitors. They are the dasabuvir, sofosbuvir, NS5A inhibitor. So they are the different drugs are there. Pegylated interferon alpha 2A 2B and ribavirin. So they can combine that if they need, or they can directly combine the directly acting antiviral agents. Now let's have a quick revision. So we have today learned about the hepatitis C virus, which is a RNA virus causing mainly the hepatitis. And what is important in the hepatitis C virus, that it is parentally transmitted, it can have the vertical transmission, and the main thing about this virus, that is the chronicity, that the 75 to 80% can develop the chronic disease, and when they develop the chronic hepatitis or carcinoma or the cirrhosis, so that can be a difficult situation for the patient. Now how we can diagnose? So main target among the virus is the antigen testing, antibody testing. So we have the third generation ELISA available for antibody testing. Newer test has come where the automated machines are available, which can directly detect the or quantitatively detect the antigen also. Now the RNA piece, that is the RT-PCR for RNA detection, that is the gold standard. You can quantify, you can know the genotype, and you can monitor it. So that is a very important to diagnose. And how to treat? So mainly now the directly acting antiviral agents are being preferred. So depending upon the genotype, you can treat the patient. So that's all for the today's lecture. If you are new to the channel, so kindly subscribe it, and if you like the video, please like and share with the other students, other person also, so that they can also have the knowledge regarding this virus. And if you want some newer topics, so you can write me in the comment section, so I can cover those topics also. So thank you very much.